Breastfeeding education session, 30 minutes. Objective: provide essential breastfeeding education to help parents understand its benefits, techniques, and address common challenges. Session outline. 1. Introduction, 5 minutes. Welcome and purpose. Briefly introduce yourself and the purpose of the session. Emphasize the importance of breastfeeding for both mother and baby. Icebreaker, if applicable. Ask participants to share one thing they've heard about breastfeeding. 2. Benefits of breastfeeding, 5 minutes. For the baby. Provides optimal nutrition with antibodies to fight infections. Reduces the risk of allergies, asthma, ear infections, and sudden infant death syndrome, SIDS. For the mother. Promotes bonding with the baby. Aids in uterine contraction and postpartum weight loss. Reduces risks of breast and ovarian cancers. Economic and environmental benefits. Saves money and reduces waste compared to formula feeding. 3. Breastfeeding techniques, 10 minutes. Positioning and latch. Positions: cradle hold, cross-cradle hold, football hold, and side-lying position. Steps for a good latch. Bring baby to breast, not breast to baby. Ensure baby's mouth covers most of the areola, not just the nipple. Check for rhythmic sucking and swallowing. Feeding cues. Early signs: rooting, hand-to-mouth movements, and soft cooing. Avoid waiting until the baby cries, late cue. Frequency and duration. Newborns feed 8 to 12 times in 24 hours. Sessions may last 20 to 40 minutes, depending on the baby. 4. Addressing challenges, 7 minutes. Common issues. Sore nipples, check latch, use nipple cream and air-dry nipples. Engorgement, breastfeed frequently, hand express milk, and use warm compresses. Low milk supply, nurse frequently, ensure proper latch, and stay hydrated. Returning to work/school. Pumping techniques and storage guidelines: store milk in clean containers, refrigerate for up to 4 days or freeze for 6 months. 5. Support and resources, 2 minutes. Encourage connecting with lactation consultants. Support groups, e.g., La Leche League. Online resources and hotlines. 6. Q&A and closing, 3 minutes. Address participants' questions. Share handouts or digital resources for further reading. Thank everyone for attending and encourage them to seek support if needed. Handouts or visual aids, optional. Breastfeeding positions diagram. Milk storage guidelines chart. Contact information for local lactation consultants. This content can be easily adjusted based on the audience or specific focus areas. Additional tips and considerations. Overcoming breastfeeding myths. Myth: I won't make enough milk. Fact: most mothers produce enough milk if the baby feeds frequently and effectively. Milk production works on a supply and demand basis. Myth: breastfeeding is painful. Fact: while some initial discomfort is common, pain is not normal. A proper latch and positioning can eliminate most pain. Myth: you can't breastfeed if you're sick. Fact: most illnesses do not require stopping breastfeeding. Breast milk provides antibodies to help protect the baby from illness. Signs your baby is feeding well. Baby seems content and satisfied after feeds. Steady weight gain after the first week of life. Baby has 6 to 8 wet diapers and 3 to 4 stools per day by day 5. You hear or see rhythmic sucking and swallowing during feeds. Practical demonstrations, if possible. Show breastfeeding positions using a doll or model. Demonstrate how to hand express milk. Show the correct way to use a breast pump, if relevant to the group. Interactive activities. Breastfeeding quiz. Ask true/false or multiple choice questions about breastfeeding myths, benefits, and techniques to reinforce learning. Group discussion. Share personal goals or concerns about breastfeeding. Discuss solutions to challenges in a supportive environment. Closing tips. Breastfeeding is a journey, and every parent-baby duo is unique. Stay patient and seek help early if challenges arise. Celebrate small successes and build confidence over time. Additional resources to share. 1. Books. The Womanly Art of Breastfeeding by La Leche League International. Breastfeeding Made Simple by Nancy Moorbacher. 2. Websites. La Leche League International. Kelly Mom. 3. Hotlines. National Breastfeeding Helpline varies by country, e.g., USA 1-800-994-9662. 4. Apps. Baby feeding tracker apps to monitor breastfeeding and diaper changes. By the end of this session, participants should feel empowered with the knowledge to start or continue their breastfeeding journey with confidence. Encourage ongoing support and remind them they're not alone.